Okay, fine. Yes. Yes. Now I'm audible. I'm hello. Good evening, everyone. Good evening. I'm Dr. Rajiv Kovil. I am a diabetologist and metabolic physician practicing in the western suburbs of Mumbai. Today we are all here to discuss about the impact that this COVID-19 has had on our lives. This was not something which was expected. Uh, Such a kind of a pandemic would ever threaten mankind was never even dreamt about a few months back. But this comes out from the script of some real thriller, supernatural movie that we are actually wondering that how a virus can actually threaten mankind and our existence on this earth. Um, Lockdown is now almost more than a month, and it would have its impact apart from economically, it on mental health. It would also have a long-term impact on chronic healthcare indices, which are diabetes, blood pressure, cholesterol, weight, and that's something we need to really take care of, because this present scenario could be the new normal for some time, and this will be not just a short-term change that we need to get into our system. There needs to be a social and cultural change which needs to come into us. We need to take hygiene to a much higher level. We need to take health literacy to a higher level, where we know what are our complications, what are our morbidities, and what does the future hold for you. So, in terms of diabetes and COVID 19, or cardiovascular disease and blood pressure and COVID 19, majority of people who have had complications in COVID 19 across the globe are patients who have had some sort of comorbid conditions. Comorbid conditions basically means that they have an underlying healthcare chronic disorder, which could be heart disease, which could be blood pressure, which could be diabetes, which could be kidney disease, which could be cancer, which could be liver disease. Diabetes per se does reduce the immunity of our system. Immunity is the thing which prevents infections from our body, and diabetes is an immunodeficient disorder, and diabetes does reduce the immunity in our body. So a lot of infections get diabetics are prone to such kind of infections, viruses, and COVID-19 is no is an entity which can actually cause infections more in a diabetic. Complications are also higher in a diabetic. Second reason is that there is a lot of immune response which is there, which is also higher in diabetics. So there are these few reasons because of which people with both type 1 and type 2 diabetes are at increased risk to get COVID 19 or corona infection, and also face complications related to COVID 19 and corona infections. So, elderly diabetics, patients with heart disease, patients with blood pressure, patients with kidney disease, elderly patients with liver disease, cancer patients are the ones who are very at high risk. So, social distancing should be complete for these individuals. It should be for everyone, but it should also be there for all the individuals as such. Just a minute, I'm just getting an emergency call. Hello. आवाज you mean? अच्छा ठीक है. You can everyone can hear me now. Is it audible? Are you able to see me? Hear me? Audible है because I have done so many webinars on this same system. Okay, okay. I hope I am audible right now to everyone. Let me just. Uh, this is something we need to consider is the new normal for us. We will have to change a lot of stuff based on new normal. So this thing is going to continue for long. It will be a cultural change we need to make. We will not go into restaurants. We will not crowd into airports, not crowd buses, we will not crowd lifts. So the social change which will come in. Hygiene will take cosmetics, I think, because hygiene is something that something was not high on our priority in India, and this will be a social and cultural change with us. COVID-19 has put a healthcare has threatened most of the well-developed care countries also with excellent infrastructures compared to India. India's infrastructure is not good, so it's good that it has not what do you call burst into a bomb or a pandemic into India and causing the complications as it did US and in China and in Italy. India's health infrastructure is not good enough. So our Prime Minister did the right job in doing a lockdown or implementing a strict lockdown a month before, and I believe the lockdown will continue for another month or so at least. And that's the best way that we can flatten the curve. Flatten the curve doesn't mean that we have taken the intention away. Uh, are you all able to hear me now? Are you all able to hear me now? You're able to hear me now? Are you here? हेलो हाँ हाँ है बिल्कुल सुन मैं फोन निकाल ही देता हूँ Are you hear me now? I'm without the you you can hear now. Something is wrong in the system, my dear, because this is what I've been I one in the afternoon. Thomas, you can hear me? Is are anybody able to hear me now? Now clear. Okay. You can hear me? Jitu, you can hear me? People, Sama saying no. अच्छा तो बिल्कुल नहीं है नहीं ये सब बराबर है are you able to hear me now? No idea what it is. ठीक है चल I will speak. There are some people who are saying you can hear me. Let me try. Yeah. Okay. Okay. So I'm going to speak a little loudly. If, I don't know, something is wrong with the system probably. So as I said that this has threatened mankind and this is something that we should consider as the new normal for all of us. This is going to be there for some time. The new normal is going to be there. We are not going to crowd into places. Social distancing will be a norm. Hygiene will obey cosmetics, and hygiene will come into a way of life for all of. Hello. Uh, 1 minute. I'm just getting some call now. Hello. Audible. No? Huh. So, so this is going to be a new normal for all of us, and we will hope that this social distancing and this lockdown doesn't continue. But I believe that it will be there for at least a month, so that this curve we can flatten it. Flattening the curve doesn't mean that we have removed the virus. Still, we do a definitive cure for the virus, we will still be fighting the virus. So the virus may not end till 20, or maybe it will go on till 2021 also. We don't know. Once we get a definitive cure, we're going to kill the virus, or we get a we get a vaccine for the virus. That will also help. So vaccine for the virus or a cure for the virus will surely flatten the curve. Till then, we will have to practice hygiene. We will have to make sure that there is social distancing and a lot of social intermingling which happens in India, and the kind of festivals, kind of religious functions, kind of gatherings we have for our marriages, and everything needs to go down. And that's the best way that we can flatten the curve and prevent infections from community transmission, as we call it. Um, this will surely have an impact on mental health, on economy, and on non-communicable diseases like diabetes, blood pressure, cholesterol, and weight. So it's very important that we, during this lockdown phase, which has been there for last 1 month, keep our motivation up. We make sure that we are able to practice a lot of self-management skills at home itself, which could be eating right, eating the right portions, having a maintained, balanced meal, making sure that we are hydrating ourselves, because this is again summer, and there's the summer and the innate immunity that we get because of the BCG vaccine may, this is a hypothesis, may help us over to tide over this corona crisis as such. Um, so we need to hydrate ourselves. A lot of vitamin C, vitamin D. We need to gargle at least twice a day, preferably with lukewarm water. Make sure that our protein intake is pretty high. Apart from that, also make sure that you are able to do some kind of exercises at home, which could be spot jogging, or if you have a treadmill at home, or any kind of yoga exercises that one can do. Make sure you stay away from tobacco and alcohol. Make sure that a lot of high fatty food is not taken. Make sure that there is a lot of time between dinner and bedtime. Best time to have at least a 12-hour intermittent fasting, so that our weight does not go up. And this is a lockdown which only not you are facing, across the globe everyone is facing, and we all will overcome this. We all will see better light, and we are already seeing light at the end of the tunnel, that we all will go and challenge this, and we'll overcome this COVID pandemic which is threatening all of us. But right now we need to make sure that we stand together in separate houses, and make sure that we do not make the slope just go up as it is going over the last 3 to 5 days, especially in Mumbai. And it's time that we really put our minds to place, and make a community effort that we will not get out of our houses for any small reason, and we will practice social distancing. We will wear a mask, because the most important part about COVID-19 infection is that in the first 5 to 7 days, when the patient does not have symptoms, he has the maximum viral load, and that's the time he can spread it to people. So you may actually not come across people who are actually coughing a lot, but those patients may be spreaders, and the one patient may be able to spread to minimum 3 to 5 people. And the aerosol, that is, it comes from sneezing, coughing, all these, even speaking, can remain in circulation for up to 8 hours. So that's the reason that the first 5 to 7 days, when the patient may not be that symptomatic and has a very high viral load, is highly infective. And that kind of that's why COVID-19 has become a pandemic, because the incubation period is very high, and the asymptomatic viral load and infection is very high. So this is the reason that we need to make sure that social distancing is practiced very well, and patients and some amount of patients at home, to make sure that our mental health is also good. Um, so, in a nutshell, is that's what I would like to say about COVID-19, without getting into the treatment part of it. Uh, Globally, we have looked at many medications which can actually cure this infection, and we're very close to a good treatment for it. Vaccine trials have started from mid-March itself across the globe. So probably in 3 to 6 months, we would have a vaccine which will come in and which will help us in treating this altogether. But till then, the hope is that we make sure that we do not make the pandemic have a linear and an upward slope, and we make sure that we are able to flatten this curve which is going up. We are more than 20,000 cases today, and with the kind of population that we are looking up of 1.3 billion, and majority of them hand to mouth existence, it's not something that we can actually we cannot threaten let a virus threaten our existence today on earth. So I am very happy to answer questions if there are any. I'm sorry for this technical glitch. I don't know. I just used this same device 2 hours back, and it worked pretty well. So I'm open to any questions. If there are any questions, you could either put it on the chat box, or you could send it to me, or you could do any of them. Sorry. Yeah. Yeah, I'm okay to questions. If there are any questions, uh, are there any questions from any of you all? I hope I'm audible. Are there any questions that I could answer? There's a question which is, can we eat mango? You can surely eat mango, and you can surely make sure that when you eat a mango, you subtract that carb from the next meal that you eat. So suppose you're having two chapatis, you have one chapati and have a mango. Make sure that that is done. Just a minute, I'm getting a call from the hello. Okay, okay, okay. Team member is giving me the questions. 1 minute. Yes, it's possible that a COVID-19 patient can be completely asymptomatic and recover without any treatment, because majority of the viruses do not require treatment. In a COVID infection, 80% of patients are asymptomatic. 80% of patients have very mild infections, 15% have mild or moderate to severe, and 5% have critical illnesses. So you can have a vast majority of patients, almost 30 to 40%, who could be asymptomatic carriers and who could have absolutely no symptoms and completely cured of it also. Next question, please. So, Prashid, you asked the question whether we can HCQ for prophylactic use. There is no data on the usage of HCQ or any randomized controlled trial on the use of HCQ as a prophylactic. In spite of that, the ICMR has come up with this protocol almost 3 weeks back, which says that close family contacts, as well as patients, as well as doctors and healthcare professionals who are on the forefront treating COVID-19 infections, should be on a prophylaxis of HCQS, which is 800 milligrams on Thursday, followed by 400 milligrams weekly for 7 weeks. So that's the ICMR has proposed. And for all patients, for all healthcare professionals who are on the forefront treating COVID-19 or close contacts of patients who are tested positive of COVID-19. Yeah, next question, please. So, Mr. John, very good question. You asked whether diabetes are at higher risk for COVID-19 infections. That's right. Both type 1 and type 2, though we have more data on type 2. Any kind of comorbidity increases the chances of complications in patients with COVID-19 infections. So, whether it's diabetes, blood pressure, cholesterol, cancer, chronic kidney disease, or liver disease, are all risks for COVID-19 infections and complications related to COVID-19 infections. The second part of the question was what exactly? Uh, So that is a very interesting question because if you compare COVID-19 to the previous COVID infection, which was SARS-CoV-1, and to Middle Eastern respiratory syndrome, which was from Jeddah, the mortality rate of otherwise overall in the general population is around 3 to 5%. But when you have comorbid conditions, the mortality rate goes up to 50 to 70% with COVID-19 infections. So when you have comorbid conditions, the fatality rate is much higher with COVID-19 infections as compared to the other two coronaviruses. Next question, please. So, this is Mr. Ajay Kumar. Your question is whether you need to, you need to report minor fluctuations. Again, what is minor fluctuations? Now, pre-meal blood glucose between 80 to 130 and post-meal between 40 to 180 is what we consider as normal. Now, if there is a lot of variability, more than 25%, you should report it to your physician. Or if you get any kind of vomiting, diarrheas, or any infections or symptoms related to COVID-19. I can see another, any chance of re-attack of COVID-19 with the same patient? Very good question. That we still don't know data. The data that we are coming get from Japan as well as Korea is that patients who earlier had COVID-19 infections have got a recurrence. So the immunity which follows COVID-19 infection, we will have to wait for a longer period of time to see whether the immunity is lifelong as or for a shorter period of time. But there are recurrence which are occurring, so we still don't know the answer whether after one infection are you completely immune for the rest of your life. Um, the, Mhm. So, pre-diabetics is a very understudied group of cohort of patients across the globe. Pre-diabetics are at risk for diabetes and cardiovascular disease. Pre-diabetics and whether their immunity goes down, we still don't have any data on that as such. But a lot of obesity. So obesity is also very common with pre-diabetes. But obesity and metabolic syndrome, those are patients with a higher waist circumference, patients with higher triglycerides and slightly raised blood sugars are at very high risk for morbidity and mortality related to COVID-19 infections. The incubation period somebody has asked is somewhere between 12 to 18 days. Uh, uh, there's another question that if a COVID-19 patient is asymptomatic, recovers from infection, yes, as I mentioned that yes, patient can be asymptomatic and can recover from any kind of infection very similar to a flu without any reason. There's a question that today media is full of news and messages about COVID-19 which can make dad anxious. How to boost immunity in a diabetic patient? I wish we could buy immunity with the help of medications. Immunity is a one's own innate response in the body. One can boost immunity by probably following a good lifestyle, eating right, sleeping well. Sleeping and COVID-19 has had a direct linear relationship. So sleep for at least more than 8 hours. Make sure that vitamin C is taken and vitamin D is also supplemented well. Vitamin D and COVID also has an infection. Yes, vitamin C tablets should be taken. Always gargle your throat with lukewarm water. Hydrate yourself, that's extremely important. These are the basics one can do to improve one's immunity. And exercise at home, importantly. Do some form of core training or some form of exercise, stationary exercise at home, so that your immunity can improve. Are there any further questions? Vitamin T C tabs without? Yeah. You can buy vitamin C tablets over the counter across the globe. So you can buy vitamin C tablets across. There's no reason for a prescription for vitamin C tablets. What is the percentage that may go asymptomatic? A large percentage can go asymptomatic. 30 to 40% could go asymptomatic. The American diabetes. There's a question which says that are diabetic patients whose sugars are well controlled also susceptible to coronavirus infection? The American Diabetes Association has come with a position statement which says that diabetics who are well controlled have the same risk as the general population, while diabetics who are uncontrolled has a 3 times higher risk of coronary infections, for corona infections as such. So it was also seen in the previous COVID, the SARS COVID infection that or epidemic that HbA1c more than 9% put you at almost 60% higher risk for pneumonias. Gestational diabetics, what is the exercise? It's apart from the topic, but GDMs, the best exercise is to walk after meals at least 15 minutes post meals, because the postprandial blood sugar is which facilitates sugar damage to the fetus. So post meal 15 minutes blood sugar is what is very, very good to do. Can trust vaccines immediately when they come in? It's a question which, so vaccines will undergo a fair amount of trial before they come in. So we all know that the dengue vaccine, which was hyped over almost last 1.5, 2 years, did not break down. So it went out. So vaccines will undergo a very fair amount of investigations and trials for it to be considered safe before we can use it. So this is the viral immunity is a very complex topic, and that's why you can imagine that there, for simple common flu, we still don't have a virus. We still don't have a vaccine. So vaccines can be made against viruses, but viruses itself mutate and change over a period of time. So it's very, very difficult to do that also. But our own immunity is the best that we have. And what we have seen in India as compared to the rest of the globe, that we are much better. Probably our innate immunity, probably our because globally taken BCG vaccination, and that has improved our innate immunity. Probably there is something that in us which is preventing the virulence of this virus, and probably that's the reason that it has not taken the kind of curve it took in Italy or in the US. Somebody has mentioned that what as an MR one could be doing. I think as what could be doing as an MR. I think social distancing would be a norm. I think some amount of telemedicine and teleconsultations or telemarketing would be norm for the next few months at least. You, yeah. Is there another question? Mm-hmm. Interesting question, Raj. The MERS, which is Middle Eastern Respiratory Syndrome, used the DPP4 enzyme for entry into the system, entry into the human body. So, using a DPP4 inhibitor when MERS was there, which is 2000, had shown a reduction in infection. Right now, there are in vitro studies that COVID-19 may also be using, apart from the ACE2 receptors, which we surely know that SARS corona uses the ACE receptors. But whether it uses the DPP4 enzyme, in vitro study says yes, but we still don't have a lot of proof of it. Maybe in some time we will have a good amount of data coming out of that. Nilesh, you have asked that what precautions should I take on field work? I think one is that the visits to doctor should be lesser. Two, you should be wearing a mask constantly. Change your mask. There are no recommendations on how to sterilize a used mask, but make sure that you're using a fresh mask on a daily basis, and hand washing and sterilizing of hands and using sanitizers will become a norm for all of us. Does temperature really affect COVID-19? It's a hypothesis that probably when summer comes in, the virulence of viruses go down, and that's what we are hopeful. That let the summer and let the sun beat in so well that the viruses itself cannot remain alive for a longer period of time. So usually the viral epidemics are usually in the winter seasons. That's why the U.S. today has said that they could look at a recurrence or a resurgence of this epidemic coming back in November and December. Uh, Jessica, you've asked whether doing household work is a good workout. I would say yes, otherwise your husband would have to do all the work. But this is called as neat kind of exercises. It does help, but you should also supplement some amount of core training exercises with your household activities as such. uh, COVID-19 can transmit twice. Through eyes, yes. Yes. COVID-19 can transmit through eyes, through nose. So it's an aerosol. So an aerosol can go through your eyes, through your nose, through your mouth. And data also shows that there is all feco-oral transmission, which means that the COVID-19 virus will be present in your stools for at least 4 to 6 weeks following infection, so that there again contamination of toilet seats or contamination of food. That's why hand washing will again be important, because there's another fecal oral transmission also. So that also with the hygiene will help. Plasma therapy will help COVID-19 infection. Interesting question, because convalescent plasma therapy is the lowest hanging fruit in any kind of viruses, and plasma therapy has been used for almost the last century, right from diphtheria to smallpox to chickenpox to SARS-CoV-1 to MERS to this. We have been using convalescent plasma therapy. It's very important that the patients who have turned negative to COVID-19 infection back, and we are able to track them and trace them, get their plasma out, and we are able to give them to a patient who is at risk. Plasma has to be given very early in the disease, but majority of the places across the globe where convalescent plasma has been used are in patients who have developed acute respiratory syndrome, and there has been good outcomes using it. The neutralizing antibody has to be very high, and it has to be at least 1 is to 640, what the US recommends, and 2 ml given twice on two separate will really help patients. Consumption of chicken is safe. We don't have any data that they can be present on. It can be on surfaces, whether it's live surfaces, whether it's chicken, whether it's plastics. It can remain in surfaces for up to hours. Uh, it can remain on surfaces, plastics up to 8 hours, metals up to 12 hours. So as an aerosol, it can remain up to 8 hours. So so there is a problem that that's the problem, that the infectivity is high and viral load of patients is high. Any other questions? Well, is done. Yeah. So I'll answer this last question, which is from Jay Chaudhary, humans can get infected with novel coronavirus of animal source. So SARS corona, the is from bats, and that's the natural resource. It required an intermediate mammalian host, which could either have been a pangolin or something else, where the S glycoprotein, which gives the crown-like appearance coronavirus, is able to infect humans. We still need a lot of research to be done in viral immunology, that how does it jumps from species to species and then finally infects humans. But this is something that we are going to, the world will have to take very seriously to prevent such kind of pandemics and threaten mankind in future. At the end, I'd like to thank all of you all for a patient hearing in spite of this technical glitch that we had, and thank the organizers also for having me here. Have a one period now. Make sure that the lockdown, during lockdown, you remain in lockdown. Take care of yourself. Stay home. Stay safe, and we'll see how the future unfolds. But there is a lot of we're going to overcome this, and there are a lot of therapies being done to overcome this. Thank you so much.